the VCA Voice podcast. I'm your host, Dr. Marie Kerl. Our goal with the VCA Voice is to showcase how VCA Animal Hospitals is taking care of the future of veterinary medicine. We'll bring our purpose to life through meaningful conversations about care, our culture, and the communities we serve. On today's episode, I'm happy to welcome Dr. Kline. Dr. Kline is a specialist in veterinary neurology. She's an associate neurologist and past medical director at VCA Northwest Veterinary Specialists in Portland, Oregon, and I'm happy to say is my long-term friend. Welcome, Karen. How are you?
I'm good. How are you, Marie?
Doing well. I'm going to jump right in with some questions. Tell me about your journey in veterinary medicine and when you first decided on this career and on your educational path.
Really good question. I remember being a kid and finding a toad in the backyard that was injured. I don't know if that was the start of the career, but I always was interested in teaching, but also have a love for animals. So it just kind of morphed. And when I was in vet school, I had a mentor who is beloved in the neurology community and with ACVIM, American College of Veterinary Internal Medicine, Bill Fenner, who really ignited my quest for becoming a neurologist because he could tell what was wrong with an animal before he even put his hands on them. So, yeah, and then went on from there. So it's been a really fun ride.
So I will share that you and I were intern mates at the Animal Medical Center and also resident mates. So that's where our acquaintances were made and taking the board exam at Cornell, the New York State Board. So,
oh boy, that was so fun, wasn't it?
It was a lot of fun. The people now don't know what they're missing since they discontinued the in-person exam.
They don't.
When you were applying for internships, what drew you to Animal Medical Center?
Well, funny you asked that because I actually did a preceptorship with a dear friend of mine, and she owned a veterinary hospital, St. Mark's Vet, down in the East Village of New York. And I was her first preceptor. When I got there, she had been a resident. And so I got a tour of AMC and was enchanted with the place and always loved New York. So that was my first pick. And I don't think I chose many other places because I just wanted to be there and just take part in the whole aura of the AMC and all the people that were there.
Yeah, it's an amazing program. You mentioned a little bit earlier about your journey in veterinary neurology. What is it that fascinates you about that specialty and your residency experiences?
You know, I think my time at AMC, and then I actually went on to be a clinical instructor at University of Missouri, which was interesting. But, you know, neurology is one of those specialties that scares a lot of people. But that's what's so interesting about it is being able to evaluate a patient and localize where the problem and then tell my imaging people where the problem, whether or not it's in the brain, the spinal cord, or the muscles or nerves. And the best part of doing this, we do surgery as well. So making a non-walking dog walk again, or just, you know, putting their client's mind at ease about, yes, we can fix this. And this is something we can help you with, and really, really guiding them through the process, but also teaching our house officers and our clients and our technicians and the nursing staff about these various topics is just a fantastic experience.
You mentioned your nursing staff. How important are your credentialed veterinary technicians and assistants to what you do and success in your job?
That's a fantastic question. As I tell our team all the time, they're the little engine that could. They keep us moving. Without them, especially in private practice, they're the ones who take the phone calls. They're the ones who do anesthesia. They're the ones who take the x-rays. They're the ones who draw blood. They're our lifeline. From a client standpoint, they're so good at communicating and helping with situations. Shout out to them, because without them, we wouldn't be able to function. Absolutely.
Tell me about your career experiences. And you mentioned University of Missouri. So you've worked a number of different places before you landed in private practice and with VCA. What did that part of your professional journey look like?
Yeah. So when I got through with my residency at the Animal Medical Center, I was trying to decide what I wanted to do. Initially, I just wanted to go into specialty practice in the Pacific Northwest or out here. And somewhere on my flight back over Nebraska, I think I remember, I decided I wanted to teach in an academic environment. So I thankfully got the role of clinical instructor at University of Missouri, which was a very enriching experience. And then also applied for a faculty position at Iowa State University College of Veterinary Medicine, where I spent about 13 years, met my spouse there. And it was a fantastic journey. You know, what's interesting about our vet students is they seemingly get younger, and I just keep getting older. And then decided to, again, take the journey of specialty practice out here in the Northwest. And I have a unique opportunity right now to do part-time work at Washington State University College of Veterinary Medicine as well. So it's kind of come full circle for me. And the teaching part of it is just a phenomenal thing. And being able to teach the house officers, the interns, the residents, and also the students and be a part of following their careers has been life-changing. VCA has been gracious enough to allow me to have this kind of hybrid position, which has been really, really great as well.
For those who are listening who haven't ever had teaching experiences, tell me a little bit more about that. What are the main things that are fulfilling about it? And are there any frustrations?
Really good question. The teaching part of it, it's like anything else. You have to mention 20 times before someone can remember things. Seeing how these students kind of get something for the first time, if they get a concept or how to localize a problem in the nervous system, or just talking about life experience and seeing that light bulb go off. As far as frustrations, you know, I think that sometimes the process can take longer than what you think it should be, but it's very enriching. You just have to have a lot of patience. I'm not a patient person myself, but when I'm talking with the students and also the clients, you know, because sometimes they don't understand the basic concepts, nor should they. And we try and put it in the context of daily things so they can actually understand. So the concepts make sense in terms of neurology, because it can be a very daunting subject. And we just want to keep it light and humorous and as applicable as possible.
And tell me about the VCA chapter of your journey and about your current role.
Yeah. So when I left my clinical instructorship, I went on to Iowa State and did my teaching gig and client service for 13 years. And I really ultimately wanted to end up in the Pacific Northwest. So I was looking for a position where I could still teach the interns, but also really give back to the profession and be in private specialty practice. And this job at VCA Veterinary Specialty Center of Seattle came up, and I was there for about 12 years, which was a fantastic thing. I will say that taking that leap from academia to specialty practice was not the easiest road, just because we took for granted, I think, that, you know, we had all the anesthesia personnel. So we had to have a change of, or I had to have a change of thought in terms of how I applied my skill set to a new group of people. But I also was able to be medical director there, and it really afforded me the luxury of learning the other side of how to run a specialty practice, because sometimes I think we take for granted, you know, the financial aspects of practice are just inherent when they're really not. When we come out of internship and residency, I don't think we have a total handle on what it takes to have a budget and run a specialty hospital.
Yeah.
But it was a great experience.
Yeah, it's really surprising how much goes into being able to have a sustainable long-term practice and keep people employed, and also to take care of patients and clients, and so many moving parts to that. That, I think, is one of the nice things of a medical director role. If anyone is thinking about starting their own practice, I think that it gives amazing experience to really consider, do you want to do that and what's involved?
That's exactly it. I think the other part of it is just how to manage over 100 employees and really what it takes to make their experience as optimal as possible. I think that's really, really important, because the culture of a practice, whether or not you're in academics or specialty practice, private practice, is so incredibly important for retention.
And your current role is with VCA Northwest Veterinary Specialists in Portland?
Yes, and I'm one of 4 neurologists.
Okay.
We just hired 2 newer neurologists, but my role is ever evolving. And I'm kind of looking at this hybrid role, part-time university, part-time private specialty practice as kind of a model, hopefully, that we can use in the future to really help to get specialists into academic positions, because sometimes in academia, we don't have as many professors and so forth and specialists. So hopefully we can look to the future and see that transpires on a more regular basis.
So what kind of schedule are you working on? Are you there every week or weeks on, weeks off? How does that look?
Yeah, so I'm 2 weeks at Washington State and 2 weeks here at Northwest Veterinary Specialists. And I really act as a mentor. I'm still seeing clinical cases. We consult all the time with each other. And the advantage of having multiple neurologists and multiple specialists is the collaborative piece that really enhances our client experience and also the quality of care for our patients. We are pretty bustling neurology service, so there's never a dull moment. And we have a great staff. Our nursing staff is phenomenal. We have a bunch of great people that really work hard to get our clients and our patients the best care possible.
Are you the only neurologist at Washington State now, or do you collaborate with someone there?
I am. We do have other neurologists who do some part-time work, but we're trying to fill in that void because one of their other neurologists left. So we're trying to drive that new path down the highway, if you will, and really focus on the teaching and learning part of it and also client service. We get exposure to large animal, mixed practice, small animal focused individuals. So it's enriching, and hopefully we can leave a mark, and maybe a couple will become neurologists. I'm not sure. So I'm looking forward to that.
So tell me a little bit about what kinds of illnesses would cause a client to seek out an expert in neurology and how you partner with primary care veterinarians for that patient care.
When we talk about neurology, we're talking about problems in the brain, the spinal cord, and the muscles and nerves. So common things we see, just like in people, would be animals that have seizures, animals that have behavior changes. You know, sometimes we see patients that are not walking, they're paralyzed in the hind limbs or all 4 limbs, or they have weakness associated with things. And then from there, we decide where we're going to localize where the problem is and then go on with our diagnostics. Most commonly, we'll see seizures, but again, depending on the breed, we'll see, more breeds more than others with specific back problems, back pain. Just like in people, dogs and cats will get strokes. So again, the risk factors are a little different, obviously. Inflammation of the brain called encephalitis. So that's something we can see fairly commonly as well. So the corollary in people, very similar to dogs and cats.
What types of problems would a primary care veterinarian be able to start with their knowledge of neurology?
Probably seizures if we have animals with back pain, because honestly, a lot of owners can't necessarily always jump to the more advanced diagnostics like an MRI, which basically is the same thing as what we have in people. So I think the biggest thing is education from a private practitioner or a day practice person would be, how do I handle this seizure case? Do I need to refer it right now? What are the indications for starting a medication? Blood work, what do I do as far as that? So we work collaboratively with our associates in day practice and private practice to come up with what our owners can afford and what their bandwidth is.
So are there particular problems that you see more commonly in cats compared to dogs?
Cat seizures will sometimes see, behavior changes and so forth. Those are probably some of the things we can see, but also cats are good at hiding things as well. So
true.
Sometimes they'll come in and the owners can be very perceptive and say, Fluffy is circling in this direction. Is this a neurologic issue? Many times we'll see changes in the nervous system that are secondary to some sort of other problem, albeit a high blood pressure, hyperthyroidism, or underlying kidney disease where we can have secondary effects. So not uncommonly will we see seizures and other changes like that in the cat as well.
So, Karen, I understand that you recently became the president of the North American Veterinary Community, NAVC. And first of all, I want to congratulate you on that. When did you first become involved in the organization and what roles have you had?
Oh, thank you, Marie. It's a great organization. I first became nominated for the board of directors back in 2018. So it's been a long process. And my journey to becoming president was what they call the executive track, where you decide you want to spend more time just climbing up the ladder, if you will. There's a lot of offshoots of what we do, not only hosting one of the biggest veterinary conferences probably in the world, VMX, but also our Veterinary Innovation Conference. We also are associated with some charitable organizations. There's many arms to NAVC, so we sponsor a lot of different veterinary educational communities and also Vetfolio, if you've heard of that. So really our goal is to do outreach internationally and also nationally as well. So there's a big footprint and a great organization, and our real goals are education and just getting veterinary empowerment for our nurses and other initiatives like that as well.
I'm most familiar with the educational pieces of NAVC. What is the charitable work that they do?
So we have just come up with NAVC Gives, which is not necessarily charity, but we identify certain individuals or organizations within the veterinary field where we can endow them with a certain monetary constituency to allow them to do their good work. For example, hospice care, just allowing people to be able to get some financial backing to be able to do the good work that they do. That's just a new thing we started. And also just very much like VCA Charities, being that helping hand in times of need and identifying underserved populations. With the Veterinary Innovation Council, there's some new exciting things coming through to help with our underserved population of pets. So that's something that's probably going to be really coming in the forefront in the next few months.
Yeah, I had the opportunity to go to the Veterinary Innovation Summit for the first time last year. Really interesting meeting. Tell me a little bit more about that one.
We always want to push forward with new initiatives and other things like that, and just getting different members of industry together to talk about topics that are first line, such as veterinary education. How can we help colleges and universities with the deficit of faculty, access to care, spectrum of care? Those are all things that we can take our industry partners and kind of work together to figure out how to tackle some of these monumental problems, and just being innovators and trying to think outside of the box. For example, where does AI go now in veterinary circles? All those things. So I think there's a ton of stuff to talk about, and there's always new ideas that come of that summit.
So let me get this straight. You are president of NAVC, you're teaching, and you're still working in practice. How do you balance all of those things?
Well, I have to say, I have my spouse, Karl, who does a lot. I have a network of friends, and this is the stuff that really keeps me going. Some days I get home and I'm like, oh my gosh, what did I forget? I've always been that person who's not necessarily always juggled things, but always got my spirit and my fire from being busy. Me being idle, the thought of retiring, I don't know, my husband always says, what are you going to do? I'm like, I'll find something else to do. But to your point, just get home and sit on the porch. We live just southeast of Portland, so getting recharged and enjoying things. But really, it's the network of friends that we get through this profession and outside of our profession that really keeps us going, for sure.
What's your favorite part of your involvement with the North American veterinary community?
I'll tell you what, I've worked with a lot of organizations. This group, from the CEO down, this board of directors is so knowledgeable and just so great to work with. And they're innovators, they're top in their field, and just our ability to collaborate and really be respectful of each other. And it's been a great experience, for sure.
So your term is a year?
A year, and then I stay on as past president. So all told, it's about a 7 or 8 year commitment, but every year I've learned something new. And also, I can contribute what I've learned on the board to our group of people at my practice too. So it's fantastic.
Karen, it's been great to catch up with you. It's always a pleasure. As we're nearing the end of our time together, what advice do you have for others in our profession who want to get involved outside of their day-to-day work, life, and jobs?
Yeah, I think giving back, I know that term is used all the time, but in the years that I've been doing this, I think volunteering for organizations in the veterinary community, there's a lot of opportunity out there. And as specialists, we volunteer on ACVIM committees all the time. But the biggest thing is in your community. If you want to read for 2 hours at a little library for kids, anything that can spark interest in the veterinary profession and getting all different walks of life involved, because that's our future, and really being good role models for what that entails. And I think that's an important thing. And again, giving back, because it can be a joyful experience and it's always fun. Or at a shelter, there's always opportunities for that, for sure.
Well, I certainly appreciate your involvement and your spirit of volunteerism and your passion for veterinary medicine and teaching and neurology. I've always appreciated knowing you and being a friend. Thank you so much for talking with me.
I really appreciate you having me.
Thank you so much for listening in. If you enjoyed today's episode, please consider subscribing. Don't forget to leave a review to let us know your thoughts, and share the episode with friends. Follow VCA Animal Hospitals on social media at LinkedIn, Facebook, and Instagram. For more inspiring stories, visit our website at vcavoice.com.